Hello and welcome, my name is Chris from christopherhole.com and welcome to this video presentation. We're going to be looking at low back pain and running and how running can affect low back pain and ways in which we can reduce the low back pain whilst we run, after we run, or just in general um, sort of around our running. So the things that we're going to look at in this presentation is we're going to describe the basic anatomy of the foot that applies to running. So we're going to pull out some of the major parts with regards to running. There is more, but these are sort of maybe the more well known and the easiest for you guys to apply when it comes to actually practicing and doing running. Then we're going to look at understanding the mechanics of heel striking and the mechanics of forefoot striking. We're going to split them up to start with, and then there's one slide at the end where we're going to bring them both together and sort of see them sort of versus each other or opposed to each other, and hopefully by the end of this you'll have a better understanding of the running mechanics and maybe some additional ideas in which you can take away and apply to your running. So without further ado, we'll get straight into the anatomy of the foot. So on a very basic level, what we have in the foot is we have bones. As you can see on the screen, we've got many different bones in the foot. We've got many different bones for our toes. We've got many different bones for the main bulk of the foot, let's say, and then we've got many different bones sort of in and around our ankle joint and where it joins to our tibia and our fibula. Then we have ligaments. There are many ligaments that join all of these bones together. We have tendons. Obviously, the main one being the Achilles tendon, and then we have muscles. There are a lot of what are known as intrinsic muscles of the foot, so muscles that lie sort of deeper in the foot. We won't really talk too much about those in this video presentation, but we are going to look at the muscles of the lower leg, the calf, and the soleus, or they're sort of the two main ones. Again, there are more, but we won't talk about those to start with. And all of these connective tissues, so the ligaments, the tendons, and the muscles, they all are working together to be able to maintain the structure of the foot. In particular, the plantar fascia ligament. And the plantar fascia ligament we're going to look at in the next slide. We're going to talk about it in a little bit more detail. So we're just going to stick to the sort of the muscles of the leg and the intrinsic muscles, the tendons, and also the bones. So as you can see on this picture here, our foot's got a lovely arch. And that's the structure that wants to be maintained in the foot, because again it's sort of how the foot has designed itself to be most efficient at distributing forces and distributing loads throughout the foot, so it doesn't sort of carry on up into ankles, knees, hips, lower back, so on and so forth. So all of these tissues are working together as a structure to reduce force and sort of maximize efficiency of movement. So what we're going to start looking at in the next slide is the plantar fascia. We're going to talk about that in a little bit more detail and sort of how it works, so its function, let's say. So what we'll do is we'll click through and we'll start talking a little bit more specifically about the plantar fascia. So the plantar fascia is a tissue that joins the heel bone to the toes. Okay, it's the part of the bone that supports the arch. Oh, sorry, it's a part of the foot that supports the arch. So it's part of, or it's one of the major tissues that keeps the arch of the foot. And how it does that is it keeps some degree of tension in it. Because if you can think, I have my foot, or I have an arch. What I can do to maintain that arch is put a band between each end of the arch and put tension in it and pull it together, and that's going to hold the arch up. And that's what the plantar fascia acts as. It acts as that band at the bottom of the arch, pulling both the ends of the arch together, holding that arch in place. So number one, it supports the arch. Number two, it runs from the heel bone all the way up to the toes, keeping that arch. Now the third thing is it acts as a spring to propel the body forward. And we're going to talk about this a little bit later on, but I'll introduce it now. Now, if you can imagine when you're running, your foot hits the floor. Now, as your foot hits the floor, what wants to happen is all the bones, the toes, the ligaments, the muscles, they all want to, in a way, sort of pull apart. And the plantar fascia also pulls apart, but because it's a tough sort of fibrous tissue, it pulls apart and springs and sort of pulls back together. So it acts as like a spring that, in a way, will, when your foot hits the floor, it will start to flatten, but then it gets to a certain point where it wants to then spring back. And then as it springs back, that helps propel the body, in a way, forward. So the plantar fascia is a very important tissue when it comes to running, walking, or just any sort of activity, as when it comes to sort of, I don't know, athletic performance or sports performance, in a way that it wants to enhance it, not only by supporting and creating arches, which is a more favourable structure, but what it also wants to do is act much like a spring, in the way that it will flatten and stretch and then spring back like a spring to help that body move forward, if you follow what I'm saying. So a part of our running is being able to take advantage of that, and it's being able to use that to our advantage, because there's one way of running that doesn't necessarily do that quite as well, and there's another way of running that does it a lot better, and we're gonna talk about that later on. But next we're going to look at the muscles of the lower leg. So we'll click through and we'll get into it. So here we have the muscles of the lower leg, the gastrocnemius and the soleus. Now the gastrocnemius is the big sort of belly-like one, fleshy one, that you can normally see on the back of the shin, and the soleus is the one that sits underneath it. Together they make up the calf muscle, or what most people know as the calf muscle. It's also joined to the heel bone via the Achilles tendon. So from the first slide, we're sort of working our way through some of the different tissues. So what the gastrocnemius and the soleus do is they help the toes point downwards, but what they also do is they decelerate the heel. So again, as we're running, what they're able to do is again maintain a good structure of, or maintain the structure and integrity of the lower leg, with so as the foot hits the floor, it then doesn't just sort of crumble into the floor. The calf will take some of the shock, it will take some of the brunt of the forces going up through the leg, and what it's able to do is again transfer those forces into being able to propel that body forward. Because like the plantar fascia, where that stretches and recoils and sort of springs itself back, that's what the soleus can do as well. Or sorry, the soleus and the gastroc can do. Is as they are decelerating the heel, the same as the Achilles tendon, they are again stretching under load. So then when it gets to a point, it can then spring back and again propel the body forward. So as you're running, you're not only using the muscles in the hip, the quads and the hamstrings to contract and sort of force you forward, but you can use this in a way, or what is known as elastic strength. So this stretching and recoiling of muscles that create a recoiling of a spring-like movement, and you can use that to your advantage without really using any extra effort, if that makes sense. It just means you just have to run a certain way, and by running a certain way, you can really take advantage of this, and it will make running or make your running that much more efficient, because you'll be using less energy to get, in a way, sort of the same result, or possibly an even better result. because it's all about efficiency. Because if you're running for a long period of time, you want to save as much energy as possible, but obviously do as well as possible, if you can follow my meaning. So the main thing with running is trying to store some of this energy as sort of an elastic energy. So as limbs stretch, they're able to spring back and use this energy without any sort of extra effort. Okay, so that's kind of what the mechanics or the anatomy of the foot and the lower leg are trying to do for you. It's then just being able to try and maximize that with the technique when you're running. So what we're now going to look at is the two different styles of running, and we're just going to see which one possibly works best with these different sort of mechanics or different parts of the anatomy. So we're going to start off with the mechanics of heel striking. So I've sort of brought in the three sort of main parts of running: the moment of impact, the mid stance, and then sort of the toe off, if you follow my meaning. So moment of impact. When we're heel striking, the toes point up. The arch of the foot is not loaded. When the heel strikes, obviously the toes have got to be pointed up for the heel to strike. So what that means is the calf and the soleus are, in a way, they're switched off. Okay, so they're not generating that elastic strength because they're in that lengthened position, but because the forefoot isn't striking, they aren't loaded. So the arch of the foot isn't loaded, so the plantar fascia isn't loaded, and the calf and the soleus aren't loaded. It's only when it gets to the mid stance does the arch of the foot begin to stretch. And what that does, that begins to load the plantar fascia. And what I mean by load is also it stretches it. So it's then able to start that recoiling. But because it's started later in the stride, it doesn't stretch as much. So you don't get as much of that sort of elastic recoiling propulsion or spring back. So then as you toe off, the toes start to point down. So what you're then doing is you're then having to contract your calf in a way where it's unloaded to loaded. So again, it's not getting that elastic sort of strength and recoiling. So all you're getting is sort of a three-quarter recoiling from just the arch. What we want to be able to do is start to get that recoiling from both the arch and the lower leg. So we can start to see that heel striking isn't maybe the most effective and certainly not the most efficient way of maximizing load on the legs. So what we're able to do is, in a way, become more efficient when we run. So what we're going to look at next is the mechanics of forefoot striking, and what we'll be able to see is how this matches the anatomy of the foot and the lower leg when it comes to running. So here we have the mechanics of the forefoot and the same three moments of running. So the moment of impact, the mid stance, and the toe off. Now, what we have here is in the moment of impact, the toes are pointing down. What this has done, this has contracted the calf and the soleus, so they are in a way engaged. The arch of the foot is loaded, and the arch of the foot begins to stretch because that force on the moment of impact wants to push the heel into the floor. So then when we move on to the mid stance, the arch continues to stretch. And what also happens is the calf and the gastroc and the soleus, they begin to stretch as well. So it starts building this elastic strength, this moment of recoiling or spring back, or however you want to call it. So from the moment of impact all the way through the mid stance, it's building up this stored energy, this spring back, ready for the toe off. And then as soon as you get to the toe off, the arch recoils and both the gastroc and the soleus both recoil as well. So what we're doing is we're not only using the big muscles of the upper leg, the quads, the glutes and the hamstrings, to move us forward, but we're maximizing the efficiency of this spring back. So it's much like a kangaroo sort of hopping um, along the plains of Australia. It's using a spring rather than sort of only the contraction of certain muscles, where it is using the contraction, but it's using the contractions much more efficiently because there's this spring bouncing along with it as well, which is then able to make the contractions and the elastic strength and the spring back and the recoiling that much more effective, making your running that much more efficient, if you follow what I'm saying. So what we're looking at is, for efficiency and effectiveness of running, the forefoot strike is much more positive in what it can do for you. You're able to get a lot more from it, because not only are you getting the force propelling you forward from initial contractions from big muscles, but also the smaller tissues, the plantar fascia, the Achilles tendon, and the two muscles of the lower leg, the calf and the soleus. They're working in a spring-like way, in a recoiling way, to propel you forward and move you forward, and make everything a lot more efficient. So what we're now going to look at is maybe some forces and how force is distributed in the two different strikes, the heel strike and the forefoot strike. So heel versus forefoot. What we have here on the right hand side is a small diagram with a red arrow on it. Obviously the diagram is of, the first diagram is of a heel strike, and the second diagram is of a forefoot strike. What the red arrow represents is the direction of the force on impact. So if we look at the first one, which is a heel strike, the red arrow basically goes straight up the shin. Now what this does, this pushes the forces on impact, which in running can be as high as 3 times your body weight, straight up through the ankle. Now we've already described that the calf and the soleus are switched off because the toes are pointing up. So what happens is those forces go straight up through the shin into the knee, and then through the knee up into the hip and up into the lower back. And that's one way of increasing the incidence of low back pain from running, is by continually striking the heel. So continually forcing 3 times your body weight up through your ankle, through your knee, into your hip and into your lower back. If we then move on to the picture on the right hand side, which is of or the second picture, which is of a forefoot strike, the direction of the force is slightly different. And what happens, the force, because of the position of the foot and the position of the ankle, the force then gets pushed behind the knee. Also, a lot of the force that's going up through can be absorbed in the Achilles, in the calf, and in the soleus, because in a way, they're turned on, they're contracted. So what we're seeing is forefoot striking is not only good for efficiency of running, so you're able to run that much easier using a lot less energy, and potentially or eventually, with the right training and the right conditioning of the ankle and the foot, you're able to move that much more efficiently, more energy being saved and getting the same or a better result out. But what we're also getting is minimal forces going up through the body into the back or into the knee or into the hip. So we're able to reduce our risk of injury and keep our our running to its maximum, if you follow. Now the only drawback with forefoot running, because everyone is so conditioned to running on the heel, the ankle, the foot and the lower leg isn't conditioned to running in that way. So one thing I don't recommend is taking your shoes off and going out and running a marathon, because your foot, your heel, your ankle, your knee, it's just not conditioned to it. So again, it's about doing the right training, it's about doing the right recovery and managing your forefoot running, because forefoot running, if you take your shoes off, you'll forefoot run. It's that, that's just a very natural thing for the body to do. You won't tend to heel strike. heel striking's come in since we've been using trainers, because the cushion, or the sole of the foot acts as a cushion for the body, but basically all the muscles of the lower leg are turned off, so the forces go straight up through still. Maybe not as much, but it still goes straight up through, and that repetitive nature of it still puts pressure on the lower back. So what we're looking for is forefoot running for efficiency and sort of minimizing our risk of injury to our ankle, to our knee, to our hip, and especially to our lower back. So I hope this has been helpful. I hope you've learned something. I hope you can take that on board. Like I said, don't go straight into forefoot running. Build into it, condition your body to be able to do it, and then start progressing with intensity, distance, so on and so forth. Okay, many thanks for watching. My name is Chris from ChristopherHole.com. I will speak to you in a future video.